Hello, I'm Dr. Donese Worden. I've been a naturopathic medical doctor for over a decade in Arizona. I enjoy delivering CME lectures and radio and television shows for the public and physicians. I belong to many professional affiliations and I'm adjunct faculty at Arizona State University. I only utilize products in my practice from companies that I know are of the highest quality and purity in the industry. World Nutrition is a company that I support. They not only provide the laboratory analysis, but also fund and support research for their products. Let's talk about enzymes. What are they and how do they work? I believe that as physicians, we get very detailed with our advice on specific nutraceuticals that we believe will be beneficial to our patients. I think for a large part, we've forgotten that enzymes are the essential building blocks of life. Without them, it's like trying to start a car without gas, even if it is a Ferrari. Enzymes speed the rate of biochemical reactions, but don't alter the direction or the nature of the reactions. In other words, they give the body the energy needed to run itself in the most efficient way. 22 years ago, I began utilizing enzyme products for professional and personal use. I watched my father struggle with allergies, severe allergies, to the point he was in a wasting state with no help from allopathic medicine. Enzymes literally saved his life. Today he's 81, traveling the world, golfing 4 days a week, dancing 3 days a week, and enjoying a full life, but not without his enzymes. On the professional side, I've worked with pro athletes for 20 years. I know the recovery and performance benefits that enzymes provide. Numerous studies from Europe show evidence of efficaciousness in accelerating recovery from exercise and injury in athletes. In fact, it was the benefit of enzymes that drove me to naturopathic medicine in the first place, a natural yet powerful substance making such great change. As a diplomate in the American Academy of Pain Management, enzymes are a mainstay in my practice for pain, inflammation, structure, and function. I would like to start with the explanation I give patients. Enzymes are found in all living things, including plants and animals. They help us digest our food, which means we may have better assimilation and ability to absorb the nutrients from the foods that we eat. They also give us the energy needed to rebuild our muscles, cells, nerves, bone, glands, and other tissues. They induce chemical reactions needed for breathing, digestion, growth, reproduction, and other important bodily functions. Without enzymes, life would not exist. Dr. Max Wolf from Columbia University started studying enzymes in the 1930s and continued through the 1960s. He determined that after the age of 27, our enzyme production diminishes. That might be okay if we consumed mostly fresh, raw foods containing their own enzymes. However, as we all know, that's very difficult to do. Therefore, enzyme products have become very important. Let's talk about the enzyme process. So think of a long string of pearls, and in each section, there are amino acids that fold in on themselves to create a certain shape. This shape is the specific enzyme. There's a space on the string of pearls that resembles a keyhole. This active site is waiting for its specific coenzyme, a mineral, a vitamin, or a trace element. The lock has the exact inverse shape of the keyhole. When the substrate locks in, the molecular structure is transformed into a different structure, and both the enzyme and the new molecule can then separate. They're then free to do their specific functions. There are two main types of enzyme supplements: digestive, which are taken in conjunction with the meal and to aid digestion, and systemic enzymes, taken between meals to avoid all contribution to digestion. Most systemic enzymes are proteases. Many companies use animal sources, however, VitalZyme utilizes plant and microbial sources. Proteases are enzymes that break down proteins. The mechanism is not fully understood. We're not sure if they're passing through the intestinal wall to function as an enzyme, or interacting with other substances that do cross and impact the inflammatory pathways. Regardless, research shows the end point for bromelain and fungal enzymes in helping break down fibrin, and extravascularly, they help decrease inflammation. There's also some evidence that they act to influence the circulating cytokines, thus affecting the inflammatory pathways and the immune processes. They may also directly hydrolyze certain pro-inflammatory cytokines while indirectly activating cytokine modulators. I've found benefit for autoimmune diseases, and this hypothesis might explain that. Along with proteases for being protein, the big picture is that lipase breaks down fats and amylase breaks down starch and carbs. There are also other specific ones that help with sugar in grains and beans, like alpha-galactosidase, which ultimately helps with flatulence, bloating, and abdominal distension. Cellulase breaks down fibers. We don't have cellulase in our system, and we want that fiber all the way through the gastrointestinal tract. Some people may need to partially break down cell walls to get the nutrients that are bound in the minerals in the vegetables. And because we can't break those fibrous walls in the veggies on our own, we need these nutrients. Next question is, where are they working? Again, big picture. Carbs in the mouth and in the stomach. Protein primarily digested in the stomach, and fats are digested in the small intestine. The completion of carbs and fat digestion is in the small intestine as well. Cooked food, aging, stress, antibiotic use, fatty foods, and illness use up our naturally occurring enzymes. The studies and my clinical experience have taught me the power of enzymes. I'm not concerned about negative feedback loops of turning off our own production. We have so many outside factors decreasing our enzyme count that by replacing them, we can only help what should be there naturally if we lived in a pristine world and ate only pure raw food. So how do we choose the right product? Look at activity, not just the weight. Some blends will show milligrams, but they should also show the activity as well. Ask your company to provide laboratory documentation on stability, purity, and activity. Are there any side effects? If I have a patient with an active gastritis, that's inflammation in the GI tract, I will utilize glutamine, aloe, NAC, other substances before I start beginning the enzyme therapy, just for a few days. I'll start at a lower dose of proteases for 3 weeks and then increase them to the recommended dosage. With nattokinase, you must think about concomitant use with blood thinners and antibiotics. I've successfully weaned patients off the medications, the blood thinners, while monitoring their INR and protimes while substituting enzymes. Also, taking enzymes may increase the concentration of antibiotics, so you can either decrease the antibiotic dosage or lower the dose of daily enzymes. As always, ask your doctor to help you with this. Enzymes are essential for health and for life. I have personally seen great benefit in my practice. I believe they increase absorption of crucial life-sustaining nutrients throughout the body. As a physician looking for alternatives to medications, I believe enzymes are far underutilized, and I hope to increase awareness. World Nutrition is a company dedicated to VitalZyme, its flagship product, and they continually design innovative delivery systems and ingredients. And important to me, they fund and support their products with research. Thank you for watching. I'm Dr. Donese Worden.